I hope that you interact with me today. I'm going to call on some of you. I'm going to reach out to you. I'm going to ask you guys questions, and I hope you give it back to me because I really do feed off of your energy, and I really appreciate it. There's a reason why I'm here, and I'm grateful that those who came out your Saturday from wherever you came from, we're here together, and hopefully we can learn a little bit about this.
I'm the quintessential old school first responder. In the system that I grew up in, you didn't talk about things that bothered you. You just dealt with them, you suppressed them, and you pushed them down. Well, that's what I did, and that's what a lot of our men and women still do. And we're finding out that's causing catastrophic failure in the mental decline of our people. No different than we know that cancer is a major thing that's plaguing firefighters. So what do? We address it. No different than drinking problems with first responders. What do? We try to address that. And so when we realize now, hey, we're having mental health issues at catastrophic levels with our first responders, what do? We address it.
So this is our second weekend of our Central Virginia EMS Expo, which is a partnership between Bon Secours, Chesterfield Fire and EMS, and Henrico Fire. Last weekend we did a bunch of classes and education on the regular stuff, you know, how to treat patients who have strokes and heart attacks and traumatic injuries. This weekend we wanted to focus on the providers themselves and their mental health. So Travis is a special speaker that was requested, and he's going to come in just to speak about mental health, post-traumatic stress, and how to manage that and how to deal with that. Talking about stress and how first responders deal with that is huge. We've had first responder suicides right here in Henrico County. No one is immune to that. So deaths in the fire service and suicide is just rampant across the country. So having someone that can talk about those dark moments and how a provider can reach out and get help is just so important to us.
And so what I do is I talk about my personal journey with mental health, my struggles with suicide, my struggles with substance abuse, my failed relationships, my struggles with marriage, and I talk about it very matter-of-factly and very openly. And what we found over many years of doing this, first responders from across the globe are tuning in. Because when I speak, although I'm telling my story, unfortunately, I'm telling thousands of their stories too. My biggest hope that people take away from what I do is I hope that it starts a conversation first with themselves, and then secondly with their families and the people that they love the most. That's what I hope more than anything. I hope that when I tell my story, I'm also telling your story too. When you leave here, if you're once a guy like me, a girl like me, like when you leave here, you think to yourself, wow, that really resonated with me, and I'm living that same life right now. My hope is when you're going to look in the mirror and say, what are you going to do about it?